Hi, it's Alicia from AdultSpeechTherapy.co, and in today's video I'm going to be sharing with you exercises that target range of motion and stretching, particularly for patients who have gone through or going through radiation due to head and neck cancer. So with these particular patients, it's always best practice to try to start these exercises before going through the radiation process. However, oftentimes we do not get the referral until the patient has already gone through radiation or they're in the process of radiation. So radiation in general can cause necrosis of the muscles, which can lead to hardening, and unfortunately this can lead to restricted movement and generalized weakness. So it's very important for these patients to complete these exercises consistently daily. So the first set of exercises I'm going to be showing you target jaw opening. So you'll want to open the jaw as far as possible. Hold it for a count of 5 seconds, then relax. I'll have them complete that 5 to 10 times, again, never to the point of pain. Emphasizing for them to complete it as wide as possible, holding for 5 to 10 seconds, then relaxing. Next, I'll move on to the tongue, sticking out the tongue as far as possible, again, never to the point of pain. Holding it there, then retracting the tongue back as far as possible. And relaxing, completing 5 to 10 of those. Then I'll have them move the tongue to one side, then the other, again holding for a count of 5 to 10 seconds. Sticking the tongue out and moving it to the left side, then to the right. Back to midline, then over to the right side. Again, holding for 5 to 10 seconds and doing 10 reps of those if possible. Then I'll move on to the neck, and I will have them first tilt the ear down towards the shoulder, starting towards the left, as far as possible, holding for a count of 5 to 10 seconds, back to midline, and again, as far as possible to the right, 5 to 10 seconds, back to midline. On the side, always emphasizing with them never to the point of pain, but to feel a good stretch. Then if they're able to turn their head, sometimes this in itself is a stretch. If they're able to, they could even tilt their ear downward, holding for a count of 5 to 10 seconds. Back to midline, turn towards the other way, looking over the right shoulder as far as possible. And if you're able to tilt your chin up, your ear down, and hold. Again, 5 to 10 seconds, back to midline. Some patients are not able to tilt, so just turning and then back the other way. And if a patient has had a neck dissection, just be really mindful of this next exercise. I will have them tilt their head up and back, feeling the stretch in the front of the neck, holding again 5 to 10 seconds. Preferably 10 seconds if they're able to. Back to midline, tilting the chin downward, holding 5 to 10 seconds, and back. So I have the patients again try to go through that set of exercises. Try to do 5 to 10 of those. I prefer a 10-second hold. Again, never to the point of pain. I can't emphasize that enough. So good luck teaching your patients how to complete stretching and range of motion exercises, particularly going through the radiation process. For everything else you need, including free PDFs, come check out adultspeechtherapy.co.